Good afternoon. My name is Archie,
And I am Cassandra Jackson.
and we are with the Breast and Prostate Peer Education Project here at Niagara Falls Memorial Medical Center. We just wanted to share some information with you all with regards to men's health and some upcoming events that we will have for the month of November in regards to that. Cassandra?
Yes, it's good to be here, and it's great to come together to talk a little bit about what's important to us this month. And as Brian said, this is Men's Health Month. We're going to be talking about lung cancer because this is Lung Cancer Month, and we're just going to go down the line and just talk about some great things. And if you at any time something strikes out to you, feel free to contact us with the information that will be posted soon, and we'll be glad to help you.
Thank you. All right, so I'll jump right in. So my focus with this job is to educate men in the community regarding prostate health. So just to start off with some of that information, we talk about who's at risk. Typically, we hear our doctors say that men 65 years of age or older, black men, or men with a family history are at higher risk of being diagnosed with prostate cancer. We have come to show with some of the information that we have been provided that black men are 1.5 more times likely than their white counterparts to actually be diagnosed. There are many different reasons for that, but what we like to stress with everybody is that they are talking with their doctors about their health care. Working with your primary care physician helps you make the best choices with regards to what to do in regards to your care, meaning that what may be good for me with regards to treatment and things of that nature may not work for some other folks. But until we start that conversation, we won't know. Symptoms regarding prostate cancer, there is a range of them, but they start off with pain in the back, pelvis, and or hips, frequency of urination, typically at night, painful ejaculation. There may be blood in the urine and or semen. And then problems with urinating, pain, or a burning feeling. I'll say for myself, I am a prostate cancer survivor, and I have been going to the urologist since my early 30s. And I started off with many, if not all, of these symptoms. Luckily, knowing that I couldn't self-cure myself, I went to the doctor, and at that time had something called prostatitis. This is something that men will experience more than likely throughout their lives because the prostate itself, as the organ, it does grow within the body. Typically, when it does this, it can prevent men from having an even flow when trying to urinate, and it causes what I will say great discomfort, which can be healed with medication. But again, it's talking to your doctor, finding out what the best care is for you, and being able to move into action on that. So when we talk about risks and symptoms, now it's who gets screened. So initially we start off with age, race, and family history that affects a person's risk category. But overall, men 55 to 69 years of age, right? And this is from the primary care physician's point of view. Black men are men with family history, which means a father, brother, or son has been diagnosed with prostate cancer prior. Should be talking to their doctors about being screened. Now, oddly enough, screening is not recommended for all men. Prostate cancer is the second leading cause of cancer death and diagnoses within New York State, only after lung cancer, right? But men that are diagnosed, not all of them are in need of immediate treatment. Prostate cancer it grows within the prostate, which is an organ of the male sexual reproductive system, right? And it does not, I won't say always, but many times it grows very slowly. So a lot of times there'll be active surveillance if a man is diagnosed with it, meaning that they don't do anything. They kind of wait, watch, and see what the best course of treatment would be for them. There are other cases, such as mine, where there is an immediacy to have either surgery or chemotherapy or some of the other things that are being recommended as causes for treatment. So, and the other part of that is there are some side effects to some of the treatments that you can get for prostate cancer. It's possible to become impotent and or incontinent. And this is something that, in doing this work and talking with a lot of men, that they have a healthy fear of. So without, again, being informed and having a primary care physician that you can really talk to and trust in that they are giving you the best advice for you, often, it becomes a detriment to us.
So, Brian, would you say that someone, what age should a guy be thinking about, if he's having any type of prostate issues? Should they be in their 20s or 30s, or, because I know you said you were pretty young when something like that happened. So
good question, right? Typically, if there is a family history, which again is father, brother, son, right? A man should be speaking with the doctor at the age of 40. It is recommended to at least start the conversation. Doesn't mean that treatment will begin, but it's good to start the conversation. And that's just another piece of the family history. Like, we don't share a lot with our doctors because a lot is not often shared with us, depending on generationally where we come from. So a lot of folks are diagnosed with these sorts of diseases not knowing that they've had some sort of family history to it. So no one's ever told them. In my case, my father was diagnosed, had undergone treatment, and was on the other side of it. And he told me maybe a year and a half, 2 years before I was diagnosed. And I know now that he did it because the doctor told him. You have sons. Your sons probably need to know that you have had this. And other than that, I probably would not have, right? Because that's just, who he is. And then when we get to men over 70, many times, because again, the prostate itself grows, most men, if they have lived to that age and they're relatively healthy, they may be experiencing some prostate issues because, again, the organ grows. They tell men over 70 not to get screened. Now, me, not being a medical professional, will still say that if you are living an active, healthy, sexual or not life and you are functioning, talk to the doctor about your prostate. It's definitely a personal choice. But without having that conversation and just taking the advice on face, people could in fact lose their lives.